Today is supposed to be what is the beginning of my work week, but last night I picked up an extra shift. And that is because we don't have enough nurses to take care of all the patients that we have on any given day. So a lot of us are working overtime, several shifts a week, just to be able to take care of the volume of patients that we have in the ICU right now. So just depending on the week, I'm going to work 4 shifts or 5 shifts instead of our 3. So today's supposed to be day 1, but day 2. So that's okay. Last night was tough. It's been a lot of emotional distress amongst myself and my coworkers. A lot of more end-of-life care and conversations. It's been really emotionally distressing. Seeing these young people get sick with families and these lives left to live that just pass away. And it's hard. You see them come in and they're gasping for air, and you intubate them and you try to reassure them that it's gonna be okay, and then it's not. And I honestly don't know how bad things are gonna get, and it's scary. Yeah, I'm gonna go take a shower real quickly, have breakfast with my kids, and try to switch to mom mode and just be a strong, reassuring person in my kid's life. Give them stability. That's the best I can do. And if anything, we're going to fake it today. Because I'm not feeling all right. But we're going to make it work. Going to make it work. Last night was a bit tough in the sense that it was just really busy for the hospital in itself. I didn't get to see our intensivist. She was so busy with several codes and admissions, lots of admissions. So we have very limited space in the ICU right now. It's becoming a bit of a problem. It is a problem, actually. There's talks of crisis nurses coming in soon and helping us out. And I would be very thankful for that.
That's Melody Nungaray-Ortiz. She is an ICU nurse at Banner University Medical Center in Phoenix, Arizona. Where what the frontline health providers like Ms. Nungaray-Ortiz are saying is that the situation is unsustainably hard. As you heard her say there, for example, she said that some of their patients are hooked up to ECMO machines, which are machines that are essentially designed to work as an external set of lungs when even a ventilator isn't enough. The ECMO machines are an extremely sensitive form of life support. Normally, it requires a 2-person team to care for a patient who's on an ECMO. But at the moment, they can't afford that many staff because there's so many people in this circumstance. And so it's 1 nurse per ECMO. That's how overwhelmed they are at the moment. And it's not just Banner University Medical Center in Phoenix alone. As of last night, intensive care units across Arizona were at 84% capacity. Every day, more than 1,000 people are being hospitalized in that state with no relief in sight. Daily case numbers skyrocketing over the past few weeks. And while the state is just barely treading water and dealing with people who are already sick, it's also struggling with a testing system that is proven to be among the worst in the nation. This weekend, residents in one part of Southwest Phoenix waited in line for nearly 13 hours just to try to get tested. It was a miles-long line of cars. 13 hours. One man told the Arizona Republic he brought his grandmother to get tested. He brought her in early at 5:30 in the morning. They sat in the sun for more than 9 hours before they decided that they couldn't wait any longer, and they just went home, and she never got tested. That is a bad sign in a place that is already looking at numbers that are off the charts, where the hospitals are already full. And so naturally, that's where the president's going tomorrow. for a big congregate in-person inside event. Because Tulsa was such a success, why not follow it up? His first stop is actually going to be in Yuma, Arizona, one of the hardest hit counties in the country. In Arizona, they were one of the first hospital systems to be overwhelmed, to have to start medevacing their patients out elsewhere. He's going to Yuma not to do anything having to do with the pandemic response. He's instead going there to talk about his wall. From there, he will head to Phoenix, to a megachurch, for a campaign speech that more than 3,000 people are expected to attend. Indoors. Yeah, Tulsa went so great. Why not start in on Phoenix next, of all places? Are you thinking about doing a meatpacking plant tour next? Maybe some nursing home events? While you're probably thinking it might be dodgy to attend a tightly packed indoor rally in a state with an exploding coronavirus epidemic, the pastors of the church where the president's going to be speaking want you to know that actually everything's fine.
Hey, gang, we have some exciting information about what we're doing to fight COVID-19 here at Dream City Church. We're probably the first church in the nation to...
Yeah, we've installed Clean Air EXP. We have a local Arizona company. It was technology developed by some members of our church, and we've installed these units, and it kills 99.9% of COVID within 10 minutes. From independent testing.
It's ionization? Is that what
ionization. It's ionization of the air, and it takes particulates out, and COVID cannot live in that environment.
So when you come into our auditorium, 99% of COVID is gone, killed, if it was there in the first place. So you can know when you come here, you'll be safe and protected. Thank God for great technology, and thank God for being proactive.
Amen.
Bless you guys.
They solved it. They figured out how to get rid of it. Totally. Nothing to worry about, I suppose. It's not like Arizona is in crisis or anything. Everything's fine. Listen to those guys. They got it all under control. Watch this space.